I came to see that mental health and physical health are two sides of the same coin. The role that I serve in, Surgeon General of the United States, is a role that's focused on the health of our country, of the United States, but we also work in partnership with other countries when we have shared challenges. This issue, mental health, has become one of those issues where we are realizing that across the population, but particularly for youth, for young people, that in the United States we're seeing rates of depression, anxiety, and suicide go up, and other countries are experiencing that as well. We're also seeing rates of loneliness and isolation that are surprisingly high across the population, and in the United States they're highest actually among young people. And that's true of many other countries as well. When I was in medical school and residency, I actually didn't learn a whole lot about mental health either, because even in medicine, it wasn't emphasized very much. There was predominantly an emphasis on physical health. But what happened is, like, when I became a doctor and started seeing patients, I started realizing that somebody might come in for an infection or for a heart attack or for complications of their cancer treatment. But when you sat down and talked to them, you realized that they were struggling with their mental health often as well. And I realized that if we didn't address that, it would be like taking care of a cut on your right arm, but leaving your left arm unattended to, right? And both matter, they're both parts of who we are. So if we want to be well and fulfilled, happy and healthy, then we have to take care of both. So this has been a journey for me as well, in recognizing how important this is. And the reason that we as an office, the Office of the Surgeon General, decided to make this a priority is because not only because we were looking at all the data and studies showing us how many people were struggling, but when we went to schools and to communities and to temples and churches and talked to people, we found that many people were in fact struggling, but they didn't know what to do about it. They didn't know how to help their children who are struggling with their mental health. So that's why we realized that we've got to do more to talk openly about this, to design solutions, to get people care, but to also get at these root causes.